So my name is Sawsan As-Sanie. I am an associate professor and director of the University of Michigan Endometriosis and Pelvic Pain Clinic. I am a board-certified obstetrician gynecologist, and my clinical practice is entirely within gynecology, focused on chronic pelvic pain, endometriosis, as well as complex minimally invasive gynecologic surgery. Uterine health is a really broad term that I would consider to be any type of symptom or condition that's associated with the uterus. There are many different conditions that can be associated with uterine health, and some of the most common include uterine fibroids, endometriosis, or adenomyosis, and all of these conditions can have very significant symptoms as well as a negative impact on a person's overall health. There are many misconceptions about uterine health amongst providers, and unfortunately, many of them are the same misconceptions that patients have. So that these include menstrual pain and heavy bleeding is normal in reproductive age women, that treatments are, limited to medications or hysterectomy, without considering less invasive options. So stigma and bias can really have a very profound negative impact on uterine health research as well as care. Unfortunately, we know that there's a huge historical bias and very poorly conducted research that have led to the idea that some conditions like endometriosis are less likely or don't even occur in certain racial groups, such as women of color. And this bias has unfortunately been really propagated through medical training. And there's a lot of work to be done to try to undo that bias and re-educate providers about the potential of these diagnoses in patients of all ethnic and racial backgrounds. There's also a lot of bias and disparities in both diagnosis and treatment. So, for example, we know that Black women are more likely to be offered hysterectomy instead of uterine conserving procedures for uterine fibroids when compared to white women, even when they've not completed their family. We know that Black women are less likely to be considered for a diagnosis of endometriosis. And so there's a tremendous amount of work to be done in this space as well. There are many challenges that we in reproductive medicine experience in research, and some of the biggest challenges that I experience is really the huge challenge in obtaining funding for research in women's health. We just really don't have a lot of adequate research data on the variability in the types and severity of symptoms that patients experience across a diverse population. So we really need to make sure that we're inclusive of patients across socioeconomic and demographic categories to make sure that the data that we're getting is representative of patients across the spectrum, both of symptom severity as well as different populations. Because if we don't get those diverse patient group into our studies, we really cannot adequately understand, what their experiences are and, what their, treatment outcomes are going to be and what their preferences are. There's a lot of work to be done to reduce well-founded fears in patients, participating in academic research studies. And so we really need to break those barriers and be more inclusive of patients and work harder to get patients into research studies. So if I have the opportunity to give advice to caregivers, patients, and researchers in this space, I would say that please do not give up hope. Your voice matters, and your voice has been an incredibly important catalyst for increasing the funding that the field has gained so far, and will probably continue to be one of the most important catalysts in continuing to grow funding and interest in this area.